In this lesson, we'll take a look at some of the terminology that we use in pathophysiology. Um, if you look at the list, there is a lot of words. It may seem a little overwhelming at first. However, as we go through the course, as you go through your careers, these words will become second nature because we do use them in medicine also. So, the first set of terms I have for you are terminology based on the disease process. The first term that we want to take a look at is diagnosis. Basically, this just identifies a specific disease. If you were to go to the doctor's office, let's say, and the doctor writes down a diagnosis on your insurance form, basically it's telling the insurance company what is the disease that you or the person has. So really, it just identifies a disease. How do we do that? We do that by taking a look at a patient's signs and symptoms. I'll define these terms a little bit later. We could take a look at lab tests such as a blood test, a culture, maybe even an x-ray, that type of thing. Okay, so for now, I want you to know the diagnosis basically identifies a disease. The next important term that we need to know is etiology. Very, very simple. Etiology is the cause of a disease, right? There's a bunch of different possibilities as far as the cause. They can be congenital, which means that they're present at birth or during the developmental process. They can be caused by microorganisms, which would be like an infection. They can be caused by immune problems, like an autoimmune disease, that type of thing. Degeneration would be like arthritis, right? Wear and tear, or even trauma, right? Sports injury, work injury, maybe a car accident, that type of thing. Right? So etiology is the cause of a disease. Now, we have two other words related to etiology. If we don't know the cause of a disease, we say the disease is idiopathic, right? So that's of unknown cause, right? Unknown etiology, right? So sometimes we just don't know what's causing the disease. If a disease is caused by maybe the treatment from a doctor or maybe a physical therapist or something like that, some type of procedure, maybe like a surgical procedure, or maybe even an error in a prescription or something like that, we say that the etiology is iatrogenic, right? So it's being caused by some type of medical treatment, procedure, that type of thing. Okay, so that's the term etiology. The next terminology that we want to take a look at are predisposing factors. Basically, these are things that promote, right here, this is what you want to highlight. They promote the development of the disease in an individual. For instance, age, right? We'll see that some things tend to become more prevalent in people as they get older, like hypertension, skin cancer, things like that. Gender, right? Females get certain disease that males don't get. Females get autoimmune diseases a bit more than males. Occupational exposure, right? So if somebody's at work and they're exposed to different chemicals and different irritants, that type of thing, right? They're more likely to have these would be predisposing factors. And then even diet, right? If people have a diet that's high in fat, high in cholesterol, right? They're more likely to get things like coronary artery disease, that type of thing. Okay, so predisposing factors, again, these are behaviors, they're things that will promote the development of a disease. Okay, the next two terms are kind of related. Prophylaxis. This is a measure designed to preserve health, but even more importantly, to prevent the spread of a disease. And a really simple example would be the use of a condom. If you think about using a condom, not only does it prevent pregnancy, but it prevents the spread of sexually transmitted diseases, maybe like HIV, chlamydia, herpes, that type of thing, right? Human papillomavirus. There's a bunch of them. So that would be an example of prophylaxis. I think the book gave an example of somebody taking an aspirin a day, type of thing for coronary artery disease. Prevention is or are measures designed to overall prevent a disease. Things like vaccinations, right? Getting certain immunizations, Diet, again, a diet that's low in fats, high in fish, that type of thing, high in vegetables, will help to prevent getting heart disease, coronary artery disease, that type of thing. Exercise is also just awesome as far as helping to prevent some of these diseases. Okay, so prophylaxis helps to prevent the spread of a disease. Prevention helps somebody from actually getting the disease if possible. Okay, the next set of terminology are characteristics of a specific disease, right? So these terms here are characteristics of a specific disease. Um, one of the terms that we use is pathogenesis. Basically, this is where we look at the development of the disease. What are the sequence of events that take place in the tissues to cause the disease? We'll look at some diseases in detail as far as their pathogenesis. Other diseases we'll look at a little bit lightly, just a lack of time. But pathogenesis, I do want you to know, is just what we look at when we look at the sequence of events. Onset. All right, so this is how the disease comes on. There's two types basically. If the disease comes on quickly, we say that is an acute onset. It's like somebody flipped a switch and the next day you're sick, that type of thing. So acute onset means that it's developed quickly. The patient usually has marked signs, maybe like like a high fever, severe pain, right? Something like that. But the disease is typically more short term. We're going to see, opposed to something that is more slow onset. The term you're going to use is insidious, right? This is a gradual onset, right? Coming on over a slow period of time. All right, so we can describe onset as either being acute, quickly, or insidious, slowly or gradual. Now, we can also take these same two terms, acute and chronic, and describe the disease. This kind of correlates with the onset. An acute disease is one that develops quickly, right? Hence the name acute. It's typically a short-term illness, and the patient does have marked signs, like I said before, maybe a high fever, severe pain. A great example of this would be an acute appendicitis, right? So, the patient today could be feeling good, but all of a sudden tomorrow they'll have like severe right lower quadrant pain. They'll have a high fever, right? There'll be nausea and vomiting and that type of thing. It's just like, boom, there it was. Opposed to a chronic disease, this is something, as I mentioned earlier, is going to develop over time, and it's typically not as severe as far as pain. The symptoms and the signs aren't as marked. A great example of a chronic disease would be arthritis. You don't wake up tomorrow with arthritis, right? It's something that develops over 5, 10, 15 years, that type of thing. Okay. A couple other terminologies that are related to characteristics of a specific disease. Sometimes we have patients that are in a subclinical state, meaning that there is some type of pathology taking place, right? So in one of the organs, maybe, or one of the tissues, pathological changes are taking place, but the patient really isn't showing any types of manifestations. This is a term I'll define a little bit more in a future slide. Manifestations would be like signs and symptoms. A good example would be somebody that has kidney damage. Right, the kidneys have the ability to really take on a lot of damage before you start to become symptomatic. All right, so we would say this person is in a subclinical state, right? They're having a pathology. It's not that there's nothing happening, but they're not really showing any specific signs or symptoms yet. Another term, we see this a lot with infections, would be a latent state. Again, the patient has no symptoms or clinical signs that are present, but when we're having an infection, this is the time that the virus or the bacteria are kind of brewing. They're reproducing, and this would be the incubation period. So during that time that you have the viral infection, let's say, they're in there, they're multiplying, but you're not showing any symptoms yet. So on an infection, we would say that is the latent state. That period of time during an infection where the microorganism is reproducing, but you, again, don't really have any signs and symptoms, is the incubation period, right? So for some viruses it could be 3 or 4 days. Other viruses it could be 2 weeks, that type of thing. We'll talk about that when we do infection, that the incubation period is variable. Now, early on in a infection, while we're in the incubation period, right, the little microorganisms are reproducing, you may not feel well. You just may feel kind of crappy, type of thing. You feel like you're achy, you're not hungry, you're very tired, that type of thing. This is what we call the prodromal period. There's just really not any specific signs or symptoms to tell you that what you have. You just kind of feel crappy. It's like the perfect example of that. So this is the early part of an infection. We call that the prodromal period, or prodrome. Now, once a person does exhibit signs and symptoms that actually help to establish a diagnosis, that would be what we call the manifestations, right? This is the clinical evidence of a disease. If the manifestations are in just one part of the body, we call that local manifestations. If the patient has general findings, like a perfect example would be a fever, that is systemic manifestations, right? So local manifestations would just be the site of the problem, is where you see the signs and symptoms. Think maybe of a mosquito bite, right? If you get a mosquito bite, you're just going to get that welt, right? That swelling where the mosquito bit you. That would be local. Where systemic manifestations, again, fever is a great example. It affects the whole body. So manifestations can be either signs or symptoms, right? What's the difference? A sign is something that we can measure or we can observe, right? You can measure a blood pressure. You can measure a pulse rate, right? You can measure somebody's breathing rate, that type of thing. So if somebody's breathing really rapidly, it's something that we can see, right? We can quantitate that. That would be a sign. Whereas symptom is something that's subjective. This is what the individual is feeling, right? Somebody may say, I feel nauseous, right? You may not see that, right? That may not show up as a sign, but it's something that the patient is telling you, that they feel something. I have a headache. Right, that's something, again, you may not be able to visualize, right, but it's something that the patient is feeling. That would be a symptom. Okay, so manifestations, again, are clinical evidence of a disease, right? And we see them as either signs or symptoms. Another term that we use in pathology, especially when we get to the skin, guys, I'll show you a lot of examples of this, are lesions. This is a local change in a tissue. They can be microscopic, or they can be visible. And like I said, we'll see them when we do the dermatology section. I'll show you different types of lesions, papules and pustules and things like that, fissures. We'll get into those in great detail. So for today, just know that they're local changes in a tissue. Some other terminology related to the characteristics of a specific disease. Sometimes we use the term syndrome. This is a collection of signs and symptoms. And we have this collection, we can then call it a syndrome. For instance, AIDS, right? Immunodeficiency syndrome. I'm sorry, acquired immunodeficiency syndrome. It's a series of signs and symptoms affecting more than one organ. PMS, right? Premenstrual syndrome, right? It's a bunch of signs and symptoms that an individual will exhibit. Now, we had mentioned this on a previous slide. We sometimes when we do a diagnosis, we use diagnostic tests. So we have here again, they just assist with a diagnosis, and we can also use once we've established the diagnosis, we can use the diagnostic tests to monitor response to the treatment. Hey, how's the patient doing? Are they getting better, right? So we'll continually monitor the blood pressure. We'll monitor blood tests. But they include biopsies also, cultures. Hopefully, as somebody's infections are getting better, the cultures will get better. They include x-rays, MRIs, CAT scans, ultrasounds, that type of thing. These things fall under the radiography. Okay. Some other terminology related to characteristics of a disease. Um, Remissions. So there's in some diseases, the patient will all of a sudden, the manifestations will get better. They'll subside or they'll even go away. Right. So that period of time, hopefully it's permanent, but even if it's for a short period of time, that would be known as a remission. Opposed to an exacerbation, this is a worsening of the manifestations, right? The patient may feel a little bit worse. A precipitating factor is a factor or a condition that triggers an acute episode, right? So somebody may do something to trigger an acute episode. A common thing that we see would be somebody maybe doing shoveling snow, and then all of a sudden they have a heart attack, right? Or they get angina, chest pain. It was shoveling the snow, the exertion was the precipitating factor. Sometimes conditions will develop complications, right? These are additional problems. We see that sometimes in dermatology where somebody has a skin lesion and the lesion will open up and now they get a secondary infection. Right, that wasn't there before. So we'll see that a lot during dermatology when we get to that section. The term we use for treatment is therapy, right? That one you probably know already. All right, so remissions, a patient gets better for a little while. Hopefully, again, they're permanent. They may be temporary. Exacerbation is when the patient will get worse. We actually see this a lot in autoimmune diseases. People will go through periods of remissions and exacerbations. They kind of go back and forth. Okay, a sequela. This is an unwanted outcome of a primary condition. Right? So this is something that happens as a result of a condition. A good analogy here would be, let's say somebody has a stroke, and now they have permanent paralysis, right, or permanent inability to speak properly, that type of thing. So this is an unwanted outcome of the stroke. Convalescence refers to the period of recovery. Right, so that's a nice easy one. The next set of terms are related to disease prognosis. This is a really important term both in pathophysiology as well as in medicine. Prognosis refers to the probability for recovery or even other outcomes. These things are determined based on average outcomes. For instance, we all know that if we came in contact with a cold virus today, right, the rhinovirus today, you would probably be sick for maybe a week to 10 days by the time you're back to normal, right? You know that's the outcome of the common cold, right? So the prognosis of the common cold is a week to 10 days. Opposed to, say, somebody diagnosed with, what's a bad one? Pancreatic cancer. Now, if somebody was told that today, right, there's a good chance they may not survive 6 months to a year, right? The prognosis is that it's rather bad. So we'll see as we look at different pathologies this semester, different conditions, we'll take a look at their prognosis. Two other terms that are important related to prognosis is morbidity and mortality. Morbidity basically just tells us the number of people with a disease within a certain group, right? So it just basically is telling us, hey, right, this many, hundreds of thousands of people have the disease. However, mortality, though, indicates the number of deaths resulting from that disease. Okay, so morbidity and mortality. Morbidity is just the total number, and then mortality is the number of deaths. As we go on to this semester, one of the things I'll be talking to you about is the flu season, right? We're coming into the flu season on a fall semester. So we'll look at, the number of people that are getting the flu and then the number of deaths from the flu, right? Something that we usually watch. Autopsy is just a term, since we're talking about death, is a post-mortem examination, right? That's probably a term that you hear. You hear it in the news all the time. But it's basically to determine what was the cause of death, if possible. Okay, still related to prognosis is epidemiology, right? The epidemiology. This is basically, you can get a degree in this if you want to. This is the science of identifying the causative factors and then tracking the pattern of occurrence of that disease, right? So, what is the causative factor? Like talking about the flu, what is the main strain this year, let's say, and then tracking the occurrence of that disease. That would be known as epidemiology, right? Epidemiology. The occurrence of the disease is basically going to be followed, right? Here's the occurrence. The occurrence is going to be followed by two things. We're going to look at the incidence and then the prevalence. Very easy. The incidence is the number of new cases in a given population, right, within a period of time. The prevalence is the number of new and old cases, right, people that have had it already within that same time period. There's a picture in the book over here, I shouldn't say picture, a graph that actually kind of gives you this, where they here they're showing you the prevalence in red. So on the left hand side, this is the number of hundreds of thousands of people. Here is the period of time. Let's say it looks like a year here, right? So you can see in the first couple months, the number of new and old cases is about, whatever the hundreds of thousands it is over here. And then in green is the incidence. This is just now showing the number of new cases, right? So the prevalence is showing the new and old, and then the green is showing the number of new. However, notice, around sometime in May, June over here, there's a spike in the number of new cases as well as the number of the old cases, right? They both go up. This is what we see is called an epidemic, right? This is a large temporary increase in the number of cases. So let's go back to that definition for a second. I just want to make sure we got everything. So epidemiology, again, is the science of identifying what are the causes and then tracking the occurrence. We track the occurrence by looking at the incidence, right, the number of new cases, as well as the prevalence, the number of new and old cases. Now, an epidemic, this occurs when a higher than expected number of cases of an infectious disease occur within a given area. Again, the example I'm going to keep giving right now is the flu, right? We usually see going into, September, October, November, the number of flu cases goes up dramatically. That would be an epidemic. A pandemic is when something becomes global. Whenever you hear pan, think global. Right, so going back to this graph over here, again, the prevalence was the red, new and old cases. Right, you can see them over here. Then green is going to be the incidence. That's the number of new cases. But notice they spike. Right, this would be the epidemic right over here. And then hopefully with treatment, the epidemic will resolve itself and not become a pandemic, right? Not become global and continuous. Okay. A couple other terms. Communicable diseases, these are infections that we can spread from one person to another, right? Sexually transmitted diseases is like the greatest examples, herpes, HPV, right? Human papillomavirus, HIV. Those are really good examples where we can just spread from one person to another. Now, sometimes you'll learn, depending on where you work, some diseases are reportable or notifiable, meaning that maybe county or state authorities mandate that an office or a hospital reports somebody has a disease. Chlamydia is an example here, and I live out in Suffolk County. It's probably the same in Nassau County, but in Suffolk County, when somebody has chlamydia, that's mandated to be reported to the county. Gonorrhea, right? A lot of times sexually transmitted diseases. All right, so this is what we call notifiable or reportable types of diseases. Okay, so those are the main terms that we're going to work with for now. As we go through the semester, we'll add other terminology also. But like I said, as you use these and as you read them, you'll see they become second nature.